Toby. Hello, everyone. Myself, Krishna Gudi, a PhD student at the College of Pharmacy, of course, at the University of Manitoba. And a very good evening for all the attendees who are attending for today's session. So firstly, I would like to, give a rationale why I chose this topic or what made me to choose this topic before we dive into today's session. So for today's seminar, I'll be talking about different types of reviews that actually exist in the field of research. I'm particularly stressing it's not just health research or a medical research, it's interdisciplinary research that could be anywhere from computer sciences to any sort of health sciences. So the first reason that made me choose this topic is when I asked Toby who are the audience that I'm going to speak about, I just came to know that it's not just the health sciences students or not just the undergrads with just the health sciences background. So there are students from multi disciplines like computer sciences or maybe undergrads or all sort of disciplines. So then I thought I need to pick a topic which makes sense for all the students. It's just not for the health sciences or the medical students. So that's the first and most important reason that made me choose this topic. And the next important reason is I know all of you are like undergraduate students who aim to get into a grad school or who wanted to pursue their higher education in their respective fields. So this topic which I'm going to discuss today, I can assure you that at least if the attendees or the trainees are able to grab some sort of knowledge from this topic, you will be easily getting into your grad schools, whatever grad school you wanted to, when I was a kid, it's always my dream to come to Canada and pursue my higher education. So it's a dream. So in this seminar, I'll be presenting about all sort of reviews that exist in research, which will definitely help you guys in attaining your goals and dreams in order to grab a seat in the grad school. So without further ado, let's dive into today's topic. Just a second. So first, I'd like to give a brief introduction about myself, like where I came from and what's my educational background. So basically, I'm from a small city called Guntur in India. So I was born and brought up in India, and then made my journey to Canada. Coming to my educational background, I hold a bachelor's degree in pharmacy in 2014, and I also have a PharmD degree, that is Doctor of Pharmacy degree from India in 2017. And after 2017, when I finished my PharmD, I actually moved to Winnipeg, where I got the offer from College of Pharmacy for pursuing my MSc in pharmacy. So it was 2017 that I came to Winnipeg initially, where I was graduated from my MSc in pharmacy from College of Pharmacy in 2019. And right away, immediately, I got an opportunity to work with my primary advisor, that is Dr. Alizadeh, in the same college, that is College of Pharmacy, where she offered me with a PhD degree. And then with that, I started my PhD in pharmacy back in 2020. Right now, I just entered my third year of the program. That is I'm in my third year of my PhD, that is in pharmacy. So this is very brief about my journey and my educational background. Without further ado, let's dive into today's topic, that is different types of reviews and research. These are the learning objectives for today's session, where by the end of this presentation, each trainee will be able to identify different types of articles that actually journals publish. So you might be aware of scientific journals that could be national or international journals, and they'll be publishing some sort of different types of articles. So for this presentation, I'll be outlining very briefly about what are the different types of articles that are actually published in any international scientific journal. And also you'll be able to outline the definition of different types of reviews that exist in the field of research. Also, each one of you will be able to understand what are the different types of reviews with their significance. For example, in which scenarios or in which situation, what type of reviews are, makes more sense. So, excuse me, I don't know what happened, it just keep on moving without me clicking the slides. I think, yeah, some technical issue, but yeah. So at last, each trainee will be able to detail the pros and cons of that particular review type. Those are the strengths and weakness of that particular review type. So these are the learning objectives for today's session. Okay, so let's begin some fun activity. So I request all the attendees to take out your mobile devices, or maybe maybe a computer or a laptop. Just type in the browser, just type polev.com/SaiKrishna GU027. Just in your browsers, that could be using your mobile devices or laptops or computers, type polev.com. Excuse me. Yeah. So just type polev.com/SaiKrishna GU027. Just type in, if you have any difficulties entering this, just type in your queries in a chat box, or yeah, you can just unmute yourself and let me or Toby know. I think, yeah, most of you got to know how to do this. Just open your browser where you usually type www. So there you just type polev.com/SaiKrishna SAIKRISHNA GU027. Okay, let's begin our first question. Couldn't actually move the slides. Okay, so Toby, can you see my slides? Yeah, you can see the question, right?
Yeah, I can see it.
Okay. So the first question is, have any one of you got a chance to publish a paper in a scientific journal? That could be a review article or a research article or any sort of a paper. Any of you got a chance to publish a paper in a scientific journal so far? I know most of your undergrads, and typically you will not be able to get a chance to publish it, but still it gives me a sense what sort of audience and how to convey the content to you guys. I believe you can see this question on your mobile devices or the laptops that where you have signed in using polev.com/SaiKrishna027. Perfect. Okay, so majority of you are okay. So yeah, I know most of you haven't got any chance to publish a paper in a scientific journal. That's fine. That's completely all right. I know usually graduate students, when they are doing their MSc or PhD, will usually get a chance to publish a paper, but not usually typically undergraduate students, but still, yeah, perfect. So let's move on to a second question. So you can just name very few article types that you might have heard about or aware of that usually journals publish. If you take any journal, they will have a sections where they publish different types of articles. Excellent. Reviews, there's a review section where they publish review articles. Scientific articles, okay. Okay, peer review. Peer review is actually a process where where the reviewers or the editorial board members review papers. Okay, excellent. Opinion pieces, research articles, perfect. So yeah, don't worry, I'm going to walk you through whatever questions I just asked you earlier. Okay, book reviews, excellent. Literature reviews, meta-analysis, perfect. Okay, let's see what are the different types of sections that usually this review the articles the journals usually publish. So the first one is the research article. So it's a separate section where most of the excuse me, sorry. So Toby, I don't know why, even though I'm not clicking onto the next, the content is popping up.
I think the Manitoba weather is just catching up. It's just lagging on us. That's all.
Oh, I don't know, because I just want to talk about research articles and I haven't clicked next, but still, you know, the upcoming see, you see that I didn't even click next. It just shows up or pops up all the information. Okay, anyways, so the first section is research articles, where it forms the majority of the articles in any journals, which means if anybody does research using any sort of original data, it is called as a research article. So one has to utilize a data or a real information using any sort of experiments, then it is called a research article. And the next type of article that usually journals publish is review articles. So review articles usually they don't deal with any sort of original data. Basically, any student or anybody, they don't conduct or carry on any sort of research, or they don't conduct any sort of a lab work. That could be a wet lab or a dry lab. They don't perform any sort of original research. They just compile, or they just put all the available information together and just write a review article. It's just a descriptive piece. Those are called as a review article. So this is the other section of articles usually journals publish. And the other one is short communications. So the short communication is something where it gives an opportunity to the researchers or the students to publish the interim results. Suppose, for example, I started my PhD back in 2020, and I started my practicals, I mean my research, and I did not wait typically until I finish my PhD, that is in maybe it could be in 2024 or 2025, in order to publish a paper. You know, I can just publish the interim results, the results whatever I got as of then. I can just publish it as a paper called short communication. So this is a section usually you find in any journal which talks about the interim results of that particular paper. Suppose with to exemplify with the COVID-19 control trials, randomized control trials, or the research going on with the COVID-19 therapeutics, you know, most of the journals, they will be publishing the short communications. Okay, what are the results up to now? Technically the trial might be for 2 years or 3 years or 5 years long, the vaccination trials, but authors wanted to show the results or the findings of the trial by publishing the interim results. I think you all understood what is the meaning of short communication. So these are the results, temporary results or the interim results of any experiment or any trial or any project that gives chance to the researchers to publish their projects. And the other one is editorials. So editorial section, these are the papers or the articles usually authored or written by the editors of that particular journal. So every journal has an editorial board, I mean like editor-in-chief or co-editor or editorial board members. So usually one of those editorial board members will be writing a 1-page or 2-page short article based upon their topic of interest. So they are called as editorials. And in other instances, some of the journals will give the opportunity to the researchers or the people to write an editorial that could be called as invited editorial or invited guest editorial. So they'll be inviting certain researchers who are experts in particular field to write an editorial on particular topic. So these are called as editorials. And the other term or the other section of the articles that usually journals publish is letter to the editor. So I always stress upon these two, do not get confused between editorials and letter to the editor. So editorials, as I said, mostly written by the editors of that particular journal, or maybe invited by somebody else or some guest editors outside of the journal to write on some specific topic. Whereas coming to the letter to the editor, that could be anybody. Suppose, for example, there is a research article or a review article published in particular journal. Suppose, for example, the Lancet or maybe the BMJ journal. So if I go through that paper, when I'm going through that paper, if I find any of my comments or anything suspicious, or suppose, for example, if I wanted to know much more details about particular method or particular thing that the authors have implemented in that particular paper, I can just write a letter to that particular journal's editor requesting that, okay, I have read a paper that was published in your journal recently, last month or a couple of months ago, and I'm just wondering, okay, what methods the authors have implemented, or what or maybe I can just point out some of the comments, and then I can just write a letter to the editor requesting the authors to respond to my comments. So this is all about letter to the editor. I think you guys are very clear about the difference between the editorial and the letter to the editor. It's just a letter to the editor. It could be written by any one of you, or maybe me, or anyone. If you have any concerns or any suggestions or anything, if you wanted to know more about that particular article published in that particular journal, only to that particular editor of that journal, you can write a letter to the editor. And coming to the next section, that is known as...
Sai, Laura has a question. Laura, feel free to move and answer your question.
Yeah, I was just wondering, are these letters published, or are they just kind of behind the scenes?
That's a good question. So these letters are actually published. So it will be published in the upcoming volume or upcoming issue, or maybe in the same issue or the volume where that, the original article that you are referring to, or that particular letter is referring to. So these letters are actually published. Yeah. So that's a good question.
Thank you.
Yeah. So yeah, it's nice to see audience. I mean, the attendees are getting engaged with the content. So the next set of articles or the section of the journal are known as commentaries. So these are something like pretty much similar to the letter to the editor. So the difference between the letter to the editor and commentary is, suppose the letter to the editor, usually it will have certain instructions, like it has to be 50 words in length, or maybe 100 words in length, or less than 150 words in length, based upon the journal. So if you have a lot to write to the editor regarding one particular article, and if the instructions are not letting you do that, so then it's time to write a commentary. Commentary is something that you are actually commenting, critically appraising an original article that was published in that journal. Suppose regarding a COVID-19 article, that was published in JAMA. I just gone through that original paper conducted by well-known researchers from a well-known university, but I have a lot of comments that I wanted to post to the authors, and then I just I just wrote a 3-page or 4-page commentary and then submitted to the journal. So this could be one way of commentary, where actually you can critically comment on a paper line to line, and you can actually write to that particular authors of that original paper. That is known as a commentary, and even this is published. So all these article types are published in a journal. And the other way of commentary, there are certain type of commentaries where actually it need not to be associated with any paper or an article that was already published. So it could be of your own idea or your own own concept. So in the past, I have published a couple of commentaries where they were not associated with any of the papers that were already published, where I'm actually commenting on the authors and the work they have done. So there is no relation to that, but the commentary could also be to the, suppose for example, I think today or yesterday, the government of Canada stated that the 6th wave is about to start or already started in Canada. So for example, if you wanted to comment and pen down your opinions, or maybe your if you have any comments regarding this, you can just write a commentary to particular journal and submit it. So that could be a commentary. The other section of articles could be case reports, for example. So case reports, just remember it. Case reports are mostly relevant to the health and medical fields, where if any physician or any healthcare provider could also be a normal public or general layman, if they come across any suspicious, new and unique side effect or adverse effect with their medications or with their disease condition, they can actually report and publish in a journal. So usually these case reports are published or reported by healthcare practitioners or physicians, or at least researchers who are working in that particular area. So these case reports are mostly related to the medication and disease. If anyone started to take a medication for some particular disease, and if they experience any new side effects or adverse effects, so they can actually report it to any journals and publish it. So basically the case report would be like a story, it starts like a 1-page or 2-page article in length, and it starts as a 64-year male patient suffering from hypertension or suffering from diabetes, who were put on so and so medications. After 3 days, they have developed the body pains, or they have developed a fever, chills. It would be like a 1 or 2 paragraphs where they describe that particular case. So those are called as case reports, and they were published in journals as a separate section. And the other one is perspectives or opinions. So these perspectives or opinions are like similar to the commentaries. If you wanted to pin down any of your ideas or opinions on any of the policy issues happening around with COVID-19, or with any at any provincial level or a national level or international level globally, you can actually do that, and it could come under this section known as perspectives and opinions. So basically here we are not using any data, we are not doing any research, we are not handling any data like wet lab, or not doing any experiments. It's just an opinion of you related to any sort of policy or any sort of disease or any sort of a field. So usually these are like 2 to 3 pages in length, or like 1,000 to 1,500 words in limit. They are not too long as research articles or review articles. So the last type of section of articles that usually journal published that I wanted to highlight is erratums. Erratums are something, as the name itself indicate, if any journal publish a paper, and after a few days or few hours or few months, if the journal editor identifies any mistake or any sort of errors in the paper itself, or maybe in the title, or maybe in the affiliation of the authors, or any sort of the corrections, if the author wants to make to that particular article, that could be a request from the author's side as well. So then they publish that particular article under the section called erratum. Erratum means, those are the articles with the revised versions, where the corrections have been made from the author's side or from the editor's side. That could be a technical error from the publishing or the production department or publishing department of that particular journal. So overall, in general, these are the different types of section of articles that usually journals publish, which I wanted to walk you guys through. So let's begin today's topic, that is reviews and research. So first of all, what is a review? As the name itself indicate, it's a review. We are just viewing it again. Even the word research, it's not something new we are doing, but we are actually searching. We are researching That means we are searching it again and again, which is known as research. So even with the review, it's like a viewing it once again. So to review has been defined as to view, inspect, and examine a second time, or more than a second time. Basically, this process is known as a reviewing or a review. So this definition will be applied to all sort of reviews that I'm going to explain in this seminar. It is broadly characterized for all review types that are in existence right now. So let's again, it's time for a quick question. Sorry. So it's time for a quick question. So just as I mentioned earlier, just type Sai Krishna GU027 in your web browsers, like polev.com/SaiKrishnaGu027 to answer this question. So the question is, do you know any sort of review types, or have you heard about any review types during your academic or research journey so far? Not necessarily you have to you have to do it, or you have done it. Maybe at least if you have heard it, like at least its name, if you are aware of any sort of different types of reviews in your academic journey so far, you can just type your answers in. Perfect. So literature reviews, good. Systematic reviews, nice. Meta-analysis, excellent. Narrative reviews, good. Okay, rapid reviews, excellent, great. Scoping reviews, awesome. Yeah, so let's move on to different types of reviews, where I'll be explaining very clearly with their significance and pros and cons. So yeah, let's look at the type of different reviews that actually exist in the field of research. As I mentioned, I don't have any control. It's just keep on going the slides. So just let them pop up on the screen, where I can explain you one by one slowly. So the first type of reviews that I wanted to talk about is overviews. So overviews are something okay, anyways, we'll go to the next slide. So these are the different types of reviews, like overviews, narrative reviews, literature reviews, scoping reviews, mapping reviews, critical reviews, mixed method reviews, state of the art reviews, rapid reviews, systematic reviews, meta-analysis, and umbrella reviews. So there are some other review types, but usually or generally these are the review types that exist in the field of research, irrespective of their field. That could be a computer science, that could be a medical sciences, or the health related fields. Broadly, these are the different review types that exist in the field of research. So let's look at them one by one very quickly. So first one is overviews. As the name itself indicates, it's an overview of particular topic. So for example, if any of your instructors of any course asks you to write maybe submit an assignment on particular topic, for example, what are the different types of therapeutics or the medications that are available to treat COVID-19 currently. So in such scenarios, you will be just putting everything together. It's like an overview, like an introduction, and then types of medication, different medication classes, or maybe on what systems they work, like nervous system or some other systems, and what are the advantages of those, what are the disadvantages of those. You'll be putting that together very briefly, very concisely, and you'll be at the same time you'll be offering an overview of that particular topic. So usually we could call them as a summary of a particular topic. So such type of reviews are called as overviews. I think I'm clear, and anybody can take the freedom right away, jump into and interrupt me and ask me any questions, or maybe even you can ask me questions at the end of the session. So looking at the strengths of this type of reviews, they can provide a broad and often comprehensive summation of of any topic area. So it provides at a glance very broad and comprehensive summary of that particular topic. So that's the advantage or the strengths of this particular review type. Looking at the disadvantage of this particular review type is the word overview is oftentimes used in even other types of review types, which I'll be talking in the next upcoming slides. And it is used as a non-discriminant word for any other reviews of varying rigor and quality. So that's actually a very disadvantage or the weakness of this particular overview. Overview, even in our daily routine, we'll be generally using this term as an overview, but it's one specific type of a review by its own. So that's one of the weakness of this particular type of the reviews. And moving on to the other type of a review, that's called as a narrative review. As the name itself indicates, if you narrate, while we are narrating a story, we'll be following a path, or we'll be following a trend where we actually narrate about any particular topic. So starting with the background or rationale, and then slowly diving into objectives and aims, and what are the methods we have used, and what are the things we are looking at, and what are the conclusions of that particular thing. It's like a systematic narrative way. So such type of reviews are known as narrative reviews. So that's what, as I mentioned, narrative reviews typically set out to bring about a deeper understanding of and provide insights into broad and complex problems. So the basic difference between narrative reviews and the other type of reviews is, so it forms a logic or logical way of explaining things, or there is a standard or a systematic way of depicting the information of that particular topic. So if that is the case, then these are known as a narrative reviews. So one of the advantages of these reviews are they tend to offer insights based on the reasoned arguments and informed wisdom. So the narrative reviews could be written by anybody, it need not to be an expert in that particular area, but if you have a reasoned arguments, or maybe if you have any wisdom on that particular topic, you are definitely welcome to write a narrative review, and which is a positive point about a narrative reviews. Looking at its con, so as I told, it's just a review article where we pile up all the information and provide our opinion and perspectives, but it lacks the methodological standard approach, which can actually introduce the bias into the paper or this review itself. So adopt a methodological approach that is less standardized and algorithmic. So there is no any standards that are usually followed while writing a narrative review. There is no any set of guidelines to be followed while writing a narrative review, which can actually can introduce a bias into the review type. So that could be a weakness of this type of reviews. So the other type of reviews which we all are very familiar about is literature reviews. Regardless of whether you are graduate student or undergraduate student or any sort of even a +2 student, if you wanted to research about any topic, we'll be performing a literature search, or maybe we'll search the literature, which is also known as a literature review. That means we are actually searching the material or the articles which are already published. So we'll be reviewing the published materials which provide an examination of recent or current literature. For example, if you wanted to start any project, that could be a master's project or undergraduate project or even an assignment or something like that, the first step we'll be doing is we'll be doing a literature review. That means we'll be examining or evaluating what exactly the current research or the current literature is talking about, or current literature is stating. So such type of reviews are known as literature reviews. Looking at its strength, it seeks to identify what has been accomplished previously. As I mentioned, so we will be reviewing already published material. Doing that, we can avoid actually the duplication. So suppose, for example, if I wanted to select a topic for my project, and if I come up with with an idea, and then once I searched the topic doing a literature review, and if I find that the topic was already being done or that project was already being performed, then actually that can avoid the duplication of doing the project once again. So that's one of the advantage of this literature reviews. And also doing the review of the literature that already exists or published, one can actually identify the gaps in that particular research area. That could be any area. Doing a thorough search of the literature that was already published, one can actually identify the gaps. Therefore, we can actually come up with the new ideas or the new research questions that can form a whole separate project. Looking at its disadvantage, it lacks an explicit intent. That means, explicit in sense a clear or open intent to maximize the scope. Doing a literature review, we are not maximizing any scope of that particular research topic or any given topic, but we are trying to get an understanding of the topic in order to identify the gaps, loopholes that exist in that particular topic. And also in literature review, we will not be doing any sort of analysis such as data analysis, or will not deal with any sort of data that's usually routinely being collected. So that's one of the disadvantage. And also any conclusions that may reach out, therefore open to bias, because we are not doing any sort of data analysis. And since the process is not explicit, and also we are not maximizing the scope of that project and not taking to the next level, it can actually lead to introduction of a bias into that particular sort of review. I hope I'm clear, and if you have any questions, please feel free to interrupt me and ask me a question. So the next type of review that I wanted to talk about is a scoping review. So the terminology seems very simple and it is very self-explanatory. The scoping means if you conduct a review which enhances the scope of that particular topic. In such scenarios, in such circumstances, we'll be opting for a scoping review. So that's what I just mentioned, like it provides a preliminary assessment of a potential size or scope of available research literature. So two things I wanted to highlight with regards to the scoping review. You could perhaps call it as a characteristics of a scoping review. The first thing is, whatever results we publish through scoping review are preliminary assessments. So why? Because the scope, there is no end to a scoping review. So as I mentioned in my second point, if you can see, as I have highlighted in the brackets, usually scoping review is an ongoing research. So scoping review in that particular time frame or in that particular time point, so what's the literature is stating, it's known as a scoping review. So these are the preliminary results, and there will not be any final results because it's an ongoing research. The results might change based upon the time points. It might be last year the results could be of one way, and this time after 1 year the results could be changed all around the coin. But that's what we call it as the scoping reviews usually publish the preliminary results or the preliminary assessments. And the second one I wanted to highlight is it is an ongoing research. And the advantage of such type of reviews is it informs policy makers as to whether a full systematic review is needed. As I told, these scoping reviews is an ongoing research, and timely it will be publishing its results. We could have perhaps called them preliminary results, which actually gives an idea to the government, healthcare decision makers, or the policy makers. Actually, it gives an idea to whether a full systematic review is needed. Systematic reviews is a one other type of reviews, which I'll be talking in the next slides, which are higher in quality and higher in standards than a scoping review. So it will actually give an idea to the researchers or the healthcare policy makers to actually perform a systematic review is needed or not. And looking at its disadvantage, scoping reviews cannot usually be regarded as a final output. As I told, these reviews are ongoing in nature, and where they'll be publishing the timely results So we cannot consider a scoping review as a final conclusion or a final output. So that's a disadvantage that's associated with this type of reviews. The next review I wanted to highlight is a mapping review. As the name itself indicates, we'll be mapping. We will be, suppose if we take any topic, we will be mapping certain areas where there is actually a need or where there is actually a chance to perform the further research. Such type of reviews are known as mapping reviews. So as I mentioned here, it will map out and characterize the existing literature on a particular topic, which identifies gaps in the research literature. Suppose, for example, if you look at the pathophysiology of hypertension. So we all know the pathophysiology of course, most of you might know pathophysiology of hypertension, how it occurs and what happens, and what are the steps associated in that particular process of increasing BP, that is blood pressure. And there are the different classes of medications which act on different sites in that process and inhibit the process to carry forward and stop the blood pressure to be elevated. Suppose I can actually go back to the pathophysiology of hypertension, and we can actually think deeper or dig deeper and map any areas where we can do further more research, or where there is a chance or a gap or a loophole where there could be furthermore research to be done. So in such scenarios, we'll be opting for this mapping reviews, where we'll be mapping out and prioritize or categorize the existing literature. We'll go back to the existing literature which is already known, and then we'll be thinking of, we'll be mapping certain areas of the points where there is actually a chance to do a further research and digging deeper into that particular topic. So that's called as a mapping review. It has been developed and defined by the evidence, usually by the policy and practice information, because for the policy decision makers and for the practice information for the clinicians or the physicians or for government, such type of reviews are very, very useful, which actually maps the existing literature and comes up with the new rationale or a new sort of hypothesis, which actually be very useful for the policy and practice information. Looking at its advantage, it could act as a valuable tool in offering policymakers, practitioners, and also researchers. And it is also an explicit process and a transparent process as well. Explicit in sense, it's a clear process and a transparent process of identifying, loopholes or gaps or any area that could further enhance the policy and practice relevant questions. So this is one of the advantage. And looking at the disadvantage, necessarily it is a time constraint and time taking, and also lacks the synthesis and analysis of more considerable approaches. What I mean with this statement is it lacks the synthesis. Synthesis means summarizing or summation of the evidence. Here we are not summarizing or summing up all the evidence. We are not synthesizing any sort of evidence. We are just identifying for different loopholes or gaps or any areas for further enhancement. We are just mapping things, but we are not summarizing the evidence. And also we are not doing any sort of analysis using any data, or we are not coming up with any conclusions. The only aim of this type of review is to identify or to map certain areas which could actually require further research. So that's the disadvantage of this type of reviews. And the other type of reviews which I want to highlight is the critical reviews. As the name itself indicates, we'll be critically looking at particular topic which is beyond mere description. We are not just describing things, or we are not just summarizing or synthesizing the evidence. Beyond that, we'll be applying some of the statistical tools or statistical analysis, and we'll be looking at that particular topic beyond the description, which is known as a critical review. And its advantage of such type of reviews are it provides an opportunity to take stock and evaluate what is of value from the previous body of work. So we'll be critically looking at the existing literature, which could actually, we can come up with a lot of new objectives or new rationale or hypothesis. And that's one major positive point with such type of reviews. And the disadvantages are it does not typically demonstrate the systematicity. That means it will not have any systematic procedure or systematic pattern, which means it doesn't have any guidelines or the steps in order to perform a critical review. Anybody, or any way we can any way these critical reviews are performed. So that's one of the disadvantage. The systematicity is will be lacked in such type of reviews, and also it will not emphasize on formal quality assessment. For any sort of a review, quality assessment is a must, and it's a quality check. So if any sort of, so far the reviews which we have discussed, none of the reviews will have a quality check. We just summarize the evidence, or we'll just put our opinions, or we'll just put all the evidence, all the information, and describe things, but we will not bother about the quality assessment, how far the information that we put together is of quality. So whether it's a poor quality or a excellent quality or a standard quality, we will not do any sort of quality assessment, which is one of the disadvantages of this review also. The other review type is mixed methods review. Just remember, broadly, the research is divided into two types. One is qualitative research, the other one is quantitative research. If you just try to describe or just put the words together in order to describe any topic without using any sort of data or numbers, that is known as a qualitative research. That could be opinions, commentaries, or that could be any sort of review articles. Most of them are known as qualitative research. But once if you use any data, or if you use any sort of numbers, or if you perform any experiments or any lab experiments or something like that, then it is called as quantitative research. You are reporting something, you are stating something, you are comparing something. So broadly, research is of two types. One is qualitative research and the other one is quantitative research. In this type of reviews, we will be pooling these both research together. So none of the review types will be dealing with quantitative and qualitative data together. Most of the reviews are qualitative in nature, where they just describe the trends. They try to put the words together, but they will not use any data, or they will not conduct any experiments. But if we combine the qualitative data and the quantitative data together and write something on some particular topic, that is known as mixed methods research. So it provides a potentially more complete or a broader picture of that particular topic, the landscape of that specific topic area. That's the advantage of such type of reviews. Coming to the disadvantage, the methodological challenges, because for the qualitative research, we'll have different standards of reporting, different standards of doing, and different standards of assessing the quality. And for the quantitative data also, we'll be having separate set of assessing the quality and reporting the evidence. When we pool these both data together, or the evidence together, it will be very, very difficult in terms of methodology. If you wanted to appraise, or if you wanted to check the quality of particular review, like a mixed methods review, it will be very, very difficult, because since we have mixed both sort of researches, that is known as quantitative research and the qualitative research. So that could be one added difficulty of interpreting the results as well.
Sai,
Yep.
Audrey has a question. The question is, are there sites where you can, essentially see the rating of the data in the research, such as the quality and the validity of the data in the research?
So that's a good question. So there are no sites. Typically, there are scales, or there are some sort of frameworks where one has to pick particular scale which suits his or her research. I mean the research project, and then can assess the quality of that particular paper. Suppose if it is a randomized control trial, or if it is a cohort study, or if it is a case control study, or if it is a retrospective study, or if it is a prospective study. So based upon the type of the research or type of the study, there are different scales or the frameworks available. We have to pick one scale, and then there are set of questions like 5 to 10 questions depending upon the scale, and then we can actually appraise the quality of that particular article. Suppose I have published an article last week, you can actually take out that article and also pick one scale which is appropriate to assess the quality of that particular article type. And then you can actually read the question. Suppose, for example, did the researcher or the author clearly stated the transparency of the methodology or something like that, a question. Yes means I'll be getting a 1 point, no means I'll be getting 0 points, or maybe I'll be getting -1 point. So end of the 10 questions based upon the score, if it is more than 5, greater than 5, or less than 5, so we can say that, okay, this paper or this article is of less quality or a higher quality. Yeah, actually there are different types of scales depending upon the type of the study design. Yeah, I hope I have answered your question. I know I'm running a bit late, but I'll try to finish off within a couple of minutes, and then we can go to a workshop where I have some 4 to 5 questions where you can answer them. So the other type of review is state-of-the-art review. As the name itself indicates, if anyone wants to perform a research which looks at the current state, what is the level or what is the position of particular topic as of now at this particular point of time. For example, at this particular point of time, what are the what is the impact of wearing a mask in order to avoid getting a COVID-19, or what is the effect of sanitizing our hands in order to prevent this COVID-19 infection at this particular point of time, at this current state of the art. At this particular point of time, if you wanted to look at any sort of questions like this, then you should be opting for a review called as a state-of-the-art review. And the research will not, and the evidence or the conclusions will not be the same all the time, because last year, they just came up with, we have to follow 6 feet minimum distance apart from person to person. And again, some other time they told 3 feet is enough, and some other time they tell it's not enough. So this, at that particular point of time, what's the impact or what's a particular topic is stating, it's called as a state-of-the-art review. I think I'm very clear. If you have any questions, you can just ask me end of the presentation. So it addresses more current matters and also offers new perspectives on issues or point out areas for further research. So these type of reviews are called as state-of-the-art reviews. Looking at its positive side, considerable value for those new to an area. Suppose, for example, if anybody is new to that area, if anyone and if that particular person go through the state of the art, what's the current evidence stating about that particular procedure or particular method or that particular policy. So it will be very useful for them to, it will give an overall picture of that particular topic in that particular point of time. And also for those who are seeking to identify potential opportunities for contemporary research, such sort of reviews would be very, very beneficial. Looking at its disadvantage, these are of time bound. As I told, if anyone does a state-of-art review on particular topic last year, the conclusions might differ from the same state-of-the-art review on the same topic if they conduct this year or the next year. So it's a time bound and time sensitive, where it may distort the overall picture. Last year people told that closing the schools might prevent the COVID-19 infection among children, but there is a paper came out this year saying that school closures or a daycare closures might have a very little beneficial effect on spreading the infection among kids or children. So such state-of-the-art reviews are they can distort the overall picture since they're time sensitive. So rapid reviews, as the name itself suggests, if you have something very urgent, very immediate, if you wanted to respond to the questions or the queries to the healthcare professionals or maybe to the policy makers or to the government in order to take decisions very faster, in such scenarios, we will be going through these rapid reviews. The perfect example would be COVID-19. If somebody asks you a question, you are a healthcare practitioner, or maybe or if you are a researcher, and if you are working for a government or for a policy decision making, if they came up with a question, you have to immediately respond to the public concerns or maybe the government or the healthcare professionals questions. You cannot take, because usually the reviews which I have mentioned in the earlier slides, they'll take at least 6 months to 1 year to publish a paper, to publish that review type. But if you take 6 months to 1 year or 2 years, in order to address one question related to COVID-19, it can take off many lives away. So in such scenarios, we have to respond very fast, summarizing all the evidence that is available on the topic, and we have to publish it within weeks or within days. So in such scenarios, we'll be going to the rapid reviews. And the last one is a systematic reviews, I think last but one. So this is the best known type, and it is the topmost or the epitome of all the review types that I have been talking about, because as the name itself indicates, systematic review. It follows a systematic procedure, explicit procedure, and a very, very transparent procedure. So, so systematic reviews are considered as the gold standard and the top standard among all the review types I have been talking about, because as I told, just putting the evidence or the literature together or summarizing literature together is not important, but also we have to assess the quality of that literature. It is very important in order to come up with a conclusion or come up with a policy change. None of the reviews I have mentioned in the past will not look at the quality assessment, but the systematic reviews is not just summarizing the evidence, but also it will clearly systematically appraise and synthesis the quality of that particular data that is present in this type of reviews. So just I wanted to highlight one characteristic of the systematic review is these type of reviews looks at a specific research question with a focused aim or objective. It will not just, the aim or the objective of these reviews will not be generalized or will not be very broad. It will be very, very, very specific. It will be very specific to that particular type of population or that particular type of a topic with a specific research question. Just remember, specific research question with a focused aim. So these are known as systematic reviews, but the disadvantage of these reviews is we cannot pool different types of reviews in order to do a systematic review. Suppose we can do a systematic review of cohort studies. We can do a systematic review of randomized controlled studies. We can do a systematic review of retrospective studies, or we can do a systematic review of case reports. But we cannot do a systematic review that has mix of all these different study designs. So it is limited to one particular study design. So that's a disadvantage of this this type of review. And the last review is the umbrella review. As the name itself indicates, it brings all the available information on particular topic under single roof. So whatever information is available on that particular topic, it is available on the internet. That could be from Google, that could be from the PubMed, that could be from any sort of the platform. It just puts all the information under a single roof. It brings all the information on that particular topic. Suppose if you look at the umbrella reviews that were already published, if you just Google, typically it will be like 30 pages in length or 40 pages in length or maybe 100 pages in length. They are like very lengthy because it comprises of all the available information that is available in Google or in all the scientific databases. So that's known as umbrella review. If you wanted to perform a review on any topic where your intention is to put all the information at one single document or at one single place, then you have to go for this umbrella reviews. So these are the different types of reviews that I wanted to highlight, irrespective of the field. You know, it could be a health research or it could be any sort of technical side. These are the reviews that exist actually in research.